Since the beginning of pandemic, healthcare has taken a center stage in India. India's budget last year in 2021 focused largely on healthcare, and within healthcare, digital healthcare and healthcare assistance has have grown exponentially over these 2 years. Today, we are with the managing director of Optum in India, Mr. Ritesh Talpatra. Uh, Optum in India is part of one of the big global healthcare company, United Health. So my first question to you, Ritesh sir, would be just tell us about about Optum Technology, which is a subsidiary of United Healthcare Group, and its journey in India.
I would like to begin with our mission at Optum. Um, at Optum, we are dedicated to helping people live healthier lives and helping make the health system work better for everyone. United Health Group, as you mentioned, our parent company, is probably much better known to your audience. I think Fortune magazine put us at number 5 on their 2021 list. So we are well known, we are big. And if you think about it, Optum provides health services, and United Health Group or United Healthcare within the group provides health benefits, and that's how we differentiate. In India, we were established in 2002, so 20 years ago, and fast forward today, we are supported by about 30,000 folks, both technologists as well as healthcare professionals working across our state-of-the-art delivery centers in 5 major cities, Gurgaon, Noida, Hyderabad, Bangalore, and now Chennai. The way I see it, Tarun, we are core to the company. Some of the most complex and critical business processes are run from India. Nearly 50% of the global technology workforce actually sits in this part of the world. For instance, we have one of the largest data sciences and analytics capabilities, I think, in the country. I could go on, but to me, the most important thing is really what comes next, and that's what keeps me busy. If we can inspire this vast pool of talent that is India to look at our mission and to come forward and help us build solutions that can help modernize healthcare for all, I think we can truly contribute to society in general.
You talked about India. So coming to India, how is the India business contributing to Optum's growth globally?
Again, the way I see it is we are like the engine room for the overall enterprise. For instance, we support over 1,900, almost 2,000 targeted processes that pretty much span the entire healthcare value chain: transaction processing, medical coding, revenue cycle management, payments. And in terms of technology, we have matured our product engineering practices. Today we help the parent organization and the group accelerate the agenda around profitable growth, around consumer-centric engagement, around digitization, analytics, and so on. And to be honest, Tarun, I'm not sure we look at work coming out of India differently anymore. I mean, India is now integrated into the fabric of the group to the point that it's very hard to tell, which is which. If you look at an intricate fabric, it's hard to tell, and that's I hope that's how we are today.
Okay. A lot of focus has been put on technology. The healthcare is now getting driven by technology. How is technology powering the healthcare industry with innovative solutions of the future? Generally in the industry, healthcare industry, and for Optum.
I would say call out a few key areas that I think are making a big mark. As I said earlier, I would like to lead with the consumer. The ability for an informed and tech-enabled consumer to research their condition, connect with people with similar issues, search and compare providers and doctors, look at different prices, and then select the clinician of choice and the site that they want to visit. Book their appointments and be reminded, in time for the appointment. Maybe even a car is sent over, in partnership with Uber or someone to pick you up and take you there. See, all of that, the whole consumer view, I think, is something that is of great interest, and it really is one of the keys for the future. And by the way, Tarun, this is not just for the young. I mean, researchers have shown that as the awareness of some of these technologies grow, their utilization actually grows across age categories. Awareness is the main thing to focus on. So next to that and related to that, I think the consumer is what I call the related area of wellness. The overall shift in focus from sick care to genuine healthcare. Where now you see, people like you and I are using our mobile phones and computers to research, to find diets, to exercise regimens. I also wear a watch that generates a lot of health data, and when possible, I want to share it with my primary provider in a very secure and safe way. So that's the other part. This move from what I call sick care to more healthcare and wellness. And the final area, Tarun, that is fascinating for me is the creation of a digital platform that allows for the interoperability of data, obviously with consent, across organizational boundaries, and allows an informed user to almost set up their own healthcare ecosystem literally in the palms of their hands. So they can, go to one kind of doctor, but go to a different area for their wellness programs, and go to a complete different area for something else. But since the data is shared and I'm in charge as a consumer, I can create my own ecosystem. So that to me is another fascinating area where technology is taking healthcare.
So you talked about that, how technology is enabling and helping consumers in getting their access to healthcare. So during this pandemic, what were the health tech trends that you witnessed?
I think across the world, actually, let me start with even before the pandemic. Some of these trends were there. It's just that the pandemic tended to accelerate those trends. For instance, the center of gravity for healthcare was already moving out of large hospitals and closer to our homes. And what COVID has done and what this whole pandemic has done is it's accelerated that journey. One of the leading management consultants, I think they said that the use of telehealth, for instance, Tarun, is 38 times higher than what it was before. And they also researched and said 83% of the patients who have used telemedicine in the pandemic will want to use it post-pandemic too. So it's now here to stay, is my point. The second important point that came out, I think, that was highlighted in the pandemic, but was already emerging, is the focus on mental health and the uptick of digital therapeutics and other factors. I think this is a heartening thing, and I think it's really taken center stage through the pandemic and beyond. And I want to end by saying at Optum, we are actually working on all sides of this opportunity. We are building out the plumbing, the technology plumbing that enables provider assets to be instantly online, ready for telehealth services. We are preparing our own physicians to provide telehealth services. And finally, we are leading in the market in creating telehealth focused health plans that you could buy at 20% less cost than a traditional plan. So we are kind of looking at the opportunity from all sides and playing in every single segment here.
Do you think technology can increase the healthcare infrastructure and also decrease the cost of healthcare for going forward? Because now technology is integrated with healthcare; it's here to stay. But healthcare infrastructure, there is a lot to be desired still. So
Sure.
yeah, so how can it help in increasing the healthcare infrastructure and also reducing the cost of infrastructure healthcare?
It's a great question, and it goes to the core of the challenge in healthcare, Tarun, what we call the triple aim, which means it's really like a triangle, and one side of the triangle is the cost that you're mentioning, but then the other side of the triangle is improved access, because a lot of people don't even have access. It's the infrastructure that you're talking about. And the third side is quality or outcome. You can lower costs, but then you cannot, it's healthcare. You can't. So all three sides of the pyramid have to be addressed at the same time, and that's the triple aim, and that's the challenge of healthcare, right? Let's take the example of US. Our biggest market and our main market. Even in the US, Tarun, over last many years, the cost of healthcare has been increasing higher than inflation rate. Right. So today you're at a position where it's affordability is a genuine issue around healthcare.
Yes.
So it's not just an India-centric problem or a third world problem or something like that.
A
It's actually
global
a
issue.
much bigger problem.
Yeah.
Yeah, it's a global issue. And part of that is understandable, Tarun, and actually good news. I'll explain the good news part of it. Because of newer medicines and because of newer procedures and protocols that our doctors now have, you and I can actually live much longer and healthier lives, even if we have some chronic condition.
Yeah.
50 years ago, that may have prevented us from living a long and productive life, but today it doesn't. But Tarun, that comes at a cost, right? So because there's cost of medicine, there's cost of care to that chronic. So therefore, healthcare cost is going up. Part of the reason, and this part of the reason is actually a good thing, that we are living longer lives, even with chronic conditions, and therefore our healthcare costs are higher. But on the other hand, Tarun, where technology needs to focus also is there are some not so very good reasons for the cost. Even in the US, for example, the administrative costs, even today, is a big part of the overall healthcare cost. And surely technology can help address that. The second part is, again, US and India, both places, fee for service is still the predominant mode of payment, right? I mean, you go to a doctor, you get paid, you have to pay. You go to another for a blood test, you have to pay. So then the incentive is to see you more and more rather than less and less, which is actually, it should be the purpose of healthcare, right?
Yeah.
And it causes wastage. That's the wastage I'm talking about. So even our payment models, technology can help shift some of these risks from the insurance company to actually the providers, the hospitals and the doctors, to say, now you take a risk too. Let's do population-based health. And for each individual in your zip code, I'll give you X amount of money. Now you're managing that money. So how can you inoculate them? Make sure you are reaching out to them. Make sure you're texting them to say they're taking care and using taking their medicines, rather than seeing them again and again and making money, right? So these are some of the techniques that we are using, in the US, for example, to move people away from a fee for service into more of a managed service. And I think that's a lesson it's a global lesson, and that has to be learned and taught. Uh, but then that's not all. Obviously, that's the cost part. There is the access part, and we talked about telemedicine, how that is rapidly increasing access for people. Use of biometrics data. We talked about how my watch can now generate a lot of data about me, and if I can find the platform to share it with a physician, even if he's remote, they can use AI and other things to look at it and say, hey, this signal doesn't look right. Let me trigger something so a nurse can call me and say, are you okay? Because your sugar all of a sudden dropped precipitously. Are you okay? It's something like that, right? So that brings down the cost. Now, if you don't move to a fee for service, there's no incentive to do that, right? I would rather you fall sick and come to see me and I make money, or come to the hospital and I make money. I know I'm being a little harsh on this, but these are realities. So that's the other part, and the third part is obviously quality of outcome, and technology can actually do a great job there too. For example, we are using modern technologies to build a standardized care pathway. So when a doctor is seeing you, there's actually an AI that tells him what's the next best action, that looks at best practices and suggests the next best course of action. So as he gives a drug, prescribes a drug, the AI knows that I'm allergic to a particular compound in the drug and says, hey, maybe you say something else. So it's bringing down the mistakes, because a big part of healthcare cost, by the way, which is hidden, is cost of mistakes. And I think using technology, we can help bring that down. But I think I want to touch on one more thing on this. The most sacred thing in healthcare is the relationship between the physician and the patient. And that's the most sacrosanct thing, right?
Yeah.
And I think the biggest thing that technology can do is help increase the quality of that. So when the patient is seeing the doctor, even if it's for 15 minutes, it's a true one-on-one where technology takes care of all the underpinnings, collates all the medical records, puts everything in front, highlights the part that the doctor should focus on. So he's not spending time looking at charts and worrying about things, but looking straight in your eye and asking you personal questions about your life, about what's happening in your life, which is the most important part, right? I think that's where technology really comes together and can really put a big impact, not just in the triangle, which is important, but also in the center of the triangle, which is the patient-doctor relationship.
Also, recently in the month of October, PM Modi launched Ayushman Bharat, health infrastructure mission. For a technology-driven healthcare service providing company like Optum, where do you see yourself fit in that mission?
No, I think I see a lot of leapfrogging here, if you will. For example, when we were growing up, and Tarun, this probably dates me more than you. We used to still have those black phones. A red phone was a big commodity. Not everybody had it, but we used to have those black phones at home.
Yeah,
But luckily, and getting those were tough. You would be in line for years to get a phone at home. I don't
yeah.
know if
BSNL
you will hear
offices
that
were,
stories from others.
yeah,
Exactly, right? Now, what India did was we leapfrogged and went to pagers and mobile phones directly without worrying about POTS, plain on telephones. That was a leapfrog. I think there is a generational leapfrog that we can do in healthcare in India. And I think what Ayushman Bharat and some of the other initiatives I'm reading in the healthcare stack really provides you an opportunity to leapfrog and take care of the infrastructure issues in a fairly cost efficient way and not go through the really high cost methods that other developed countries went through, but leapfrog and go directly to maybe a cloud enabled infrastructure that is much cheaper, and even like a small doctor can easily plug in with an iPad and he can get on the cloud and he can share. So you can leapfrog many generations of technologies and
yeah.
avoid a lot of costs. So I'm very encouraged by some of those, and clearly we have the capabilities, we have the knowledge, and we have the interest to bring some of them in. We are trying to create some volunteer groups to say, can we donate 4 hours per day or 3 hours per day, like a large team, and help put up code that can be used as part of the stack. So we're exploring all opportunities, and we really want to play a role as individuals, frankly, but also as Optum in that. But
Okay.
but just to be clear, we don't play in the local market. There's no revenue incentive. We want to do it as part of being part of the environment. We have 30,000 people. We are probably the leading health tech company in India. We want to contribute.
So we are living in a world which is, shaken by pandemic. So I have to ask you about pandemic. How can technology help prevent future pandemics? And what are some of the challenges that, that this pandemic has taught us, that these are the challenges? People were ignoring it. They were there, obviously, but it has bared in front of all of us. So this it's a two-part question. First, how
Yeah,
technology can help prevent future pandemics, and what are the challenges basically that have come to fore now?
yeah. I don't want to be bold to say we can prevent uh, a, a
Maybe
pandemic,
be
future
more
pandemic.
prepared. Be more
Yeah, only
prepared.
through.
Yeah,
But yeah, exactly,
yeah.
exactly. But yeah, you're exactly right. It can help us prepare, anticipate, and prevent the spread. So those are areas where I think healthcare technology can really help us. Predicting healthcare events and intervening to prevent rapid spread. This goes into AI and big data, and disease prevention. Then there is also the question of mobile and wearable technologies and how it can support the overall public health response, including population surveillance, case identification, contact tracing, evaluation of interventions. All of this, Tarun, can help people keep people from getting hospitalized, because the health system needs time to prepare better, right? And if you can keep people from getting hospitalized by using all of this, you're helping out. Then finally, drones and robots can deliver essential services in a truly contactless manner. um, you know Finally, I have to say that recent advances in genomics are providing a window of opportunity. A good case was some of the drugs, some of the vaccines that were brought out so quickly, and that's because advances in genomics, and that's making, using technology and AI, you can actually reduce the time to discovery of a new drug or vaccine. So these are all ways in which technology is helping, and I just want to say, Tarun, that here in Optum in India, actually we are working on every single instance that I mentioned. Every single example I gave you, we actually have projects and we have people working on every single aspect of that. So it's
Great.
exciting time to be in health tech, because of exactly the reason you said. We are experiencing these things and we are trying to solve for them, which makes it so exciting.
Yeah. Finally, I just want to ask you, what is your vision for the future of healthcare in India?
I think Tarun, our mission says it all. I mean, dedicated to helping people live healthier lives and making the health system work for better for everyone. And I think really where I feel we should point to. And there are several threads that went through our conversation today, Tarun, that I just want to highlight. One is it has to be patient centric, right? It has
Yeah.
to be a patient centric approach. We've tried other approaches, and I don't think those approaches work. In the end, it has to be a patient centric approach to healthcare. It has to anticipate the patient's needs. So anticipation is the biggest thing here. It has to involve the patient in our healthcare journey, because often a patient is just told this is what, but you have to involve that person. The person is a sentient person with knowledge and with abilities. They need to research, they need to know. So and then location, what is convenient for the patient. That is also, is it a hospital or is it their home, and is it somewhere in between? So patient-centered approach, I think, is critical to that vision. And then the second important part is focus on the provider experience. So, in this case, whether it's a doctor or a nurse, how can technology, as we earlier discussed, Tarun, help them make the right decisions, make fewer errors, and frankly, give them more time to focus on what's important, so that technology takes care of the rest. And finally, I'll bring up the point, Tarun, that you said in the beginning. How does all of this make healthcare more affordable, more accessible?
Yeah.
Within that, Tarun, if we can build technologies that steer our people towards affordable generics than other medicines, where we can save them money. If we can reduce the costly errors for clinicians, then that can save money. If we can equip the elderly with the right sensors in their home, they can actually live independently, or maybe in their own homes, instead of having trouble at an age, and then having a lot of money being spent on it. So these are all areas in which I think we have to work a lot on, and the good news is we are trying to work on it here at Optum, and I'm sure elsewhere across the health tech ecosystem. And I would urge future technologists that if you have a passion for solving complex problems, and if the mission really matters to you, if the mission of solving for critical ailments for the future is something that resonates more than, for example, social media, then I think this is the place to come. Health tech is the place to come and do your life's best work. I think this is the place to be.
Yeah, thank you, sir. Thanks for your time, and it was a great conversation. You shared a lot of, you shared your vision and how technology and Optum is working to improve the healthcare experience and improving the patient and physician relationship. That's great. Thanks for your time.
Thank you.